Hello and welcome to this video from Baker Health for carers who are bringing a young person to an initial health assessment. The aim of this video is to fill you in on everything that will happen at the initial health assessment so you know what to expect, answer any questions you have, I hope, and to help you to know what you need to do beforehand and what to bring to the appointment. It's nothing to worry about, you don't need to be stressed about it, and we genuinely believe that these medicals are an amazing chance to help your young person to thrive, to recover well, and to be the very best that they can be in life. We first of all want to say thank you to you for everything you're doing as a carer. We think you're amazing. What you do can really change these kids' lives and is such a big contribution to society. So we realise that sometimes it isn't easy at all, but a big thank you and well done. We're excited about partnering with you. My name's Chris, I'm a GP, and for the past 10 years I've been doing medicals on kids coming into care, and for the past 7 years I've been leading a team of GPs doing these medicals both on children coming into care and on their carers. And our passion is to deliver high quality medicals and reports that change the lives of these young people and help them to recover and to thrive. So why is the young person having this initial health assessment? Well, the government requests that all young people have a medical done within 28 days of coming into care. And the idea is to find out everything we possibly can about that young person and then to come up with a plan at the end that addresses any issues that there may be to just try and help make that child thrive as much as possible. Okay, so we will talk about their birth, we'll talk about how school's going, how they are physically, how their mental health is, how they are emotionally, how they are with you at home and coping in the placement, their vaccines, their medical conditions, their medication. We'll then examine them and then we come up with this plan at the end. And the aim, as I say, is to find out concerns or issues and to address them. What happens during the medical? Well, first of all, we have this discussion about those areas that I've said already. So a nice comprehensive discussion, and it's a three-way discussion generally between yourselves, the young person and the doctor, but possibly also the social worker or the parents, and we're keen to hear from all of you and for us to work together. We are aware that there may be sensitive issues that make the young person upset when we're talking about them, and we can't always avoid those sensitive issues. So what we would always say is that if the young person's finding it too much, they can just put their hands up like this and tell us and we can back off. Then we can get the information another way. If you as a carer have concerns about the young person, then we would urge you to include them in your carers report when you fill them out to help us to know what they are. And we know that sometimes carers have concerns that would be quite upsetting for the young person to hear. So it's a great chance for you to convey all the issues to us, and then we will filter that delicately in the way that we talk to the young person. After that, then we go on to examining the young person physically. It takes about 15 minutes. We weigh them, we measure them, we listen to their chest, we have a feel of their tummy, look in their ears and their throat, check their joints and do a full comprehensive check. We will lift up clothing, but we'd rarely take off underwear, and if we do need to expose any sort of sensitive areas of the body, then we would do that in careful discussion with you, with the young person, and we normally get a chaperone to join us. And we won't proceed with anything sensitive like that if everyone isn't entirely comfortable, and if that is the case, we'll make alternative arrangements. And then at the end of the appointment, we come up with a plan. And the idea of that plan is to address any of the issues that we've identified. So it might be dental check, it might be they need an eye test, it might be that they used to be in a football club and they're missing it. It might be that you've got concerns about their schooling or they're wet in the bed at night. Whatever it is, we'll pop it down there and then we'll come up with suggestions and a plan as to how to address those. And it really is a great chance for everyone to get issues off their chest and for us to make a way forward for those. There are some videos on our website that young people can watch to help them to understand what to expect at the medical. There's a video for primary school age children under 12, and there's one for secondary school age children 12 to 17. So do have a look on our website and do encourage them to have a look before you come so that they don't need to worry about the appointment. What about chaperones? Now, chaperones are when we get another adult in the room who's purely there to just accompany us and to provide a second pair of eyes to help the patient to feel more relaxed and at ease. And we use chaperones readily at these appointments, so if you feel at all uncertain or you'd like a chaperone to be present, please just tell us. But there's two key times when we'd involve a chaperone. One is when we talk to the young person who's secondary school age and they would like to talk to us alone without you there, and it's no offence to you, it's just so that they can talk a bit more freely about things like sexual health or substance misuse or any other concerns that they don't feel relaxed about talking with you. We'd invite one to come and join us simply because we wouldn't normally be alone with a young person during one of these medicals. Another time when we involve a chaperone is if we need to do a sensitive examination, as I've talked about already, but that is rare. We often have carers wondering whether they need to attend these appointments, and we appreciate that your lives are busy and that you do a huge amount for these marvellous young people, but if you are at all able to attend the appointment, we would urge you to, because your information and insights are so helpful along with the young person's, and it's surprising how often there's a slight variation, let's say, between their opinion and your opinion, and the carer provides such useful insights. So please do come along if you can, and we, as I said, will offer the young person a chance to talk to us on their own as well. How long does the appointment last? It normally lasts around an hour, sometimes a bit less long, sometimes a little bit longer. What if there are multiple siblings? Now, there's two options if there are multiple siblings. One option is that each child has their own separate appointment, and we're happy to do that. And the other option is a group appointment with them back to back. Now, the individual appointments are really handy where the children are placed with different carers, where the children, say, don't get on well together, or where there are sensitive issues, for example, teenagers with issues that you don't feel would be appropriate for the other sibling to hear about. So in all of those scenarios, we'd encourage you to have individual appointments. The group appointments can work quite well from your perspective as a carer, just having one appointment to come to and getting it all over and done with in one go. And it can work quite nicely from our point of view for certain groups of siblings because they share quite a lot of common information between them. Often for primary school age siblings, all placed with the same carer, nothing too sensitive or personal, they work quite nicely. But it's entirely up to you. You know the children far better than we do, and we're happy for you to choose at the time of booking what you'd prefer. What about if English is not the child's first language, or if they're not confident in English? Well, we're very used to and familiar with working with interpreters to translate our discussions into the child's native language. Please make sure your social worker is aware of the need for an interpreter when booking, and do mention it to us at the time of agreeing the appointment, and we can make sure that the interpreter is booked by the social worker. The interpreters are so good at helping the young person to feel at ease and helping to just get more information and more of those subtleties that they struggle with a limited knowledge of English. There are also some good resources on our website under the carers section for unaccompanied asylum seekers, with forms translated into various of the common languages for asylum seekers on both information about the initial health assessment, so the kind of stuff I'm talking about now, and also bloodborne virus testing, which you don't need to worry about unless we bring it up at the initial health assessment. What about where the information goes, or what happens at the end of the medical? At the end of the medical, we will write the discussions that we've had up into a report, and that report will contain the plan at the end, which is the key bit, as far as I'm concerned, of the action points that we need to do, and a copy of that plan will be given to you. A full copy of the report will go to the GP and go on their medical records, and then summaries or copies of the plan will go to the social worker, to the birth parents, and to the school nurses and any other healthcare professionals that need them. The young people are given an opportunity to say if they don't want one of those particular people to receive the information, and we do our best to respect it as best we can, but we can't make any promises. And we would always warn you and the young people that there are certain occasions when we as doctors and healthcare professionals have to disclose or share information even against the young person's wishes. So if there's something of a safeguarding nature where the child's at risk, so criminal exploitation or sexual exploitation, then we would have to share that with the social worker or escalate it accordingly. The young person also has a chance to have a copy of their report if they want to, and they're above 13. So for young people who are 13 or older who have capacity, then we'd offer them a copy of the plan like you get, and if they're above 16, then we offer them a full copy of the report. Sometimes young people only want to have a look at your copy, and other times they're not bothered and they don't want to look at anything. So it varies, and we'll ask everyone what their preference is. But it is important they have a chance to take ownership of their records. And I just warn you that if they do want to look at it, sometimes some of the issues are quite sensitive. So please, if you could be with them when they look at it and just help them, help support them, help answer any questions they may have. We are always writing these reports with it in the back of our mind that the young person may look at it in due course. So we do put it through that filter, but sometimes the sensitive issues are unavoidable. So what do you need to do before the appointment? First of all, when we send you the booking information, there'll be a CARERS report, and we'd be ever so grateful if you could fill that out. It contains key information of any concerns or issues that you're aware of with the young person, and is such a good chance for you to convey sensitive information that you don't necessarily want to say in front of the young person. Secondly, for children aged 5 to 16, there's a questionnaire called the SDQ, Strengths, Difficulties and Weaknesses questionnaire, which is an assessment of how the young person is developmentally, from an independence point of view, and it'd be really helpful if you could fill that out, and we'll pass that on to the social worker. We would also recommend that the young people watch their video on our website. So there's one for primary school age, one for secondary school age, and it will just help them to be relaxed and hopefully help them to not worry about the appointment and to own it for themselves. So do if you can. What should you bring to the appointment? Well, if you could bring the CARERS report and the SDQ report that I talked about, that'd be marvellous. If you have any health letters or hospital appointment letters or A&E attendance letters, do bring them along as well, that'd be brilliant. The red book is ever so helpful, so if you have the red book, then please bring it along, and if you don't have it, if you could ask the social worker if they have a copy of it, that would be marvellous. And then finally, if you were able to bring along some refreshments and activities for primary school age kids, but something to keep them occupied when we're having boring adult talk, and something to keep them from being hungry and thirsty, that would be marvellous, please. Thank you. What if you need to change the appointment? Don't worry, okay? We understand that life's busy and sometimes things happen. So a few top tips, if that's all right. First of all, if you could please prioritise this appointment, that would be great. As I've mentioned already, the government set this target of doing the medical within 28 days or a month of going into care, and it's taken quite seriously. Part of the reason that we've been asked to do it as a company is because we provide these medicals so quickly and work really hard to fit within that time frame. So if you could do your utmost, put play dates on hold, put dentist appointments on hold, and prioritise this, we'd be ever so grateful. Secondly, if you have a chat with a social worker, they might be able to help you with things like bringing the young person to the appointment or other issues. Do have a chat with them, okay? And then thirdly, if changes are necessary for the appointment, then do drop us an email, and you can see the email on our website in the Contact Us section. Now, linked with needing to change or cancel the appointment is the question of what happens if the young person is refusing to come to the appointment. And we do recognise that this is quite a common occurrence in the older group of kids, the sort of teenagers, and so please don't be alarmed if this is the case. Now, a few top tips. First of all, if you can share with them some of the information that you've heard on this video, that would be great. And if you can persuade them at all to watch their age appropriate video, that would also be really great, so that they know what to expect, and hopefully we can put their mind at rest. If that's not working, then please have a chat with your social worker, and once again, they are experts at chatting to kids, helping them to feel relaxed and putting them in the loop. So see what magic the social worker can do. Okay, and then thirdly, there are some alternative options that you could discuss with a social worker, and that's a planning meeting, which is where Adults talk about the child in their absence because the child's not willing to engage, or a remote initial health assessment where we do it over Teams, so you can be at home, the young person could be in their room, they don't need to feel so intimidated necessarily, and we can be flexible around them. Okay, and some of these changes, like the remote option or the planning option, can be done at quite short notice, so we don't necessarily need to cancel the appointment, and we can then stick within the time frame. So do have a chat with your social worker, and once again you can get in touch with us through the contact us section on the website or the email address on the letter you get. We at Baker Health take feedback really seriously, so if you have any suggestions, any improvements, any things you think we could have done better, then please get in contact with us, again through the contact section on our website, and we'd love to hear from you. Finally, thanks again for the wonderful job you're doing as carers. You make such a big difference to these young people's lives, and we're really looking forward to meeting you and working with you through this initial health assessment to help address any issues that the young person is suffering from, so that we can achieve a joint objective of helping that child to recover and to thrive and to be all that they can be in life. Looking forward to meeting you. Thank you so much.